Why do you believe Macregen's platform technology, OPHTHAMIZE, could be so valuable?
OPHTHAMIZE has the potential to deliver many different drug candidates, therapeutic agents, for the first time using eye drops to potentially millions and millions of patients with self-administration at home. And this raises the opportunity for a huge amount of value both to Macregen and to patients worldwide.
Describe specifically how cell-penetrating peptides in combination with various drugs could deliver drugs to the retina.
Our early experiments in ex vivo porcine eyes have shown that our lead drug candidate, MIDIA, for the treatment of potentially all forms of AMD, is topically delivered to the sclera and conjunctiva, and then we believe its primary pathway is through the suprachoroidal space and back to the retina. All of these drugs, both the MIDIA and many others, are able to be treated by patients self-administered to the top of the eye with eye drops.
Describe the stage Macregen is currently at in connection with experiments testing Macregen's lead drug candidate, MIDIA.
At the moment, Macregen, in collaboration with our partner at the University of Birmingham, England, has nearly completed the proof of concept studies in ex vivo porcine eyes to allow MIDIA with cell-penetrating peptides to be delivered by eye drops across the surface of a pig eye, and the results for bioavailability, also known as the therapeutic amount of the drug from the surface of the eye to the retina, looks very promising.
Describe how OPHTHAMIZE could otherwise be used to deliver other drugs and therapeutic agents.
One of the great features and opportunities that OPHTHAMIZE presents is that cell-penetrating peptides, in particular the ones that Macregen holds the rights to and intellectual property for, has the ability to associate with a number of different therapeutic agents, drug candidates, and their respective molecules to carry drugs that are delivered via eye drops across the surface of the eye to the back of the eye, in particular the retina and other parts of the eye, for the first time.
Explain Macregen's plans in terms of generating revenues in the coming months and years.
Macregen's platform technology, OPHTHAMIZE, allows and provides for the opportunity to take the drug candidates approved or near to being approved for many other companies, particularly in the area of ophthalmology, for their molecules to associate with cell-penetrating peptides to be delivered for the first time across the surface of the eye, and that will allow for licensing payments, milestone payments, and eventually acquisition of certain parts of the Macregen's platform technology, OPHTHAMIZE, to be acquired by those companies.
Describe the number of patients worldwide who could benefit from self-administered eye drops.
At this time, it is estimated there are about 200 million people worldwide with age-related macular degeneration, AMD, usually affecting both eyes. And if you add those kinds of numbers to the number of patients that also might benefit eventually that suffer from diabetic retinopathy, uveitis, and other eye diseases of the eye, then we are talking about patients that could self-administer in the hundreds of millions of patients, often with treating both eyes.
Describe how topical eye drops could benefit patients, reduce physician time, healthcare costs, and impact the field of ophthalmology.
OPHTHAMIZE, for the first time, provides an opportunity across a broad spectrum of major eye diseases for patients who typically, in certain eye diseases like wet AMD, require intravitreal injections every couple of months. Allows them to be treated at home with assistance or on their own to deliver their drugs directly to their eye via eye drops, thereby eliminating physician time, patient time, and the cost of the intravitreal injections by a practicing physician or healthcare professional.